Today we will be demonstrating injection sites.
There are 3 different categories for injection sites. We have the intradermal, the subcutaneous, and the intramuscular. We're going to start with the intradermal category. And I will say for all these injection sites, you will need to know the landmarks of all these for your checkoff. So for the inner forearm, the first one, 3 fingers from the wrist, 4 fingers from the antecubital. In the middle third, the inner portion, you want to inject. So the most common injection here, you can think of your TB testing that you had done prior to starting the nursing program. The next one is the inner upper arm. So for that one, we're going to be thinking of birth control for that one. Now if I can have you turn to the side. The next one is the scapula area. So for that one, we're thinking on the scapula. So for this, we can think skin testing. Now we're going to move on to the subcutaneous injection sites. For the first one is the abdomen. So 2 inches surrounding the umbilicus is what we're going for there. Then we have our lateral aspect of the arm. So for that one, we're going to be able to think pinch an inch. Again, for all these subcutaneous ones, we want to be able to pinch an inch. The next one is the lateral aspect of the upper thigh. So again, being able to pinch an inch with that one. And again, if I can have you turn. The next one, we are thinking the subscapular area, so below the scapula. So we can think bra fat, but for our checkoff, we're going to say subscapular area. So being able to, again, pinch an inch. Lastly, we have the upper ventral dorsal gluteal area. That one's a fun one to say, upper ventral dorsal gluteal area. So this is your love handles, we can think of it, but again, you want to be able to pinch an inch for that one. Our last category is the intramuscular. The first one is our deltoid. So for the deltoid, you want to put your pinky on the acromion process. And then for that one, we're going to draw a line from your patient's axilla, so their armpit. Create a V with the base of your V being on that imaginary line and injecting between your index and your middle finger for that one. So then, if we're moving over to Mr. Bones this time, putting our pinky on the acromion process, drawing that imaginary line from your patient's axilla at the base of your line, you're going to put the V and you're going to inject between for that one. Next one is going to be our ventral gluteal. So this one, you're going to think about how your patient is positioned. If it's your patient's right that you're going for, you're going to use your left hand and vice versa. So if you can have your patient pop out their hip, this makes it much easier to locate the greater trochanter with your palm. So again, if you can pop out your hip, so then you can feel it there. Then your index finger, you want to be reaching straight up, so straight vertically, towards the anterior superior iliac spine. In your middle finger, you're going to be reaching dorsally, so backwards, towards the posterior superior iliac crest, and you want to inject between your index finger and your middle finger. And your thumb is pointing towards the umbilicus for that one. So then, moving to Mr. Bones for this one, again, we're going to palm your greater trochanter. Your thumb is pointing towards your patient's umbilicus. Your index finger, as you can see on him, I'm needing to move my hand up off the greater trochanter to have my finger on the anterior superior iliac spine and my middle finger on the posterior superior iliac crest, and I'm injecting between them. So next is your vastus lateralis. So for that one, if you can again have your patient pop their hip so you can locate their greater trochanter. You want to locate their lateral femoral condyle, which for that, it'll feel like a little notch when you feel it. You're going to split the leg into thirds, and down the middle third, you're going to inject. But the portion you're going to inject is important. We don't want to go straight anterior. We don't want to go straight lateral. We want to go anterior lateral. So at a 45-degree angle with that. So again, on Mr. Bones, for the vastus lateralis, we're going to palm the greater trochanter, locate the lateral femoral condyle, split the leg into thirds and inject in the anterior lateral, so at that 45-degree angle. Not straight forward, not straight to the side, but at that 45-degree angle. And this concludes